My paper will be on medical missions. It's a quite long paper, but I'm trying to make it as short as possible for for why I have chosen medical mission as my area of research is that I have started. I'm basically a student of history, and I have started my work on colonial health policy in Indian subcontinent, and there I have found that hundreds and thousands of Indians died for the skeletal medical system introduced by the colonial government in India. But at the same time, I found that hundreds and thousands of Indians also survived. So after my first research, I tried to find the answer how those Indians survived. And I found that it was the medical mission, the medical missions in India that helped to save all these thousands and thousands of lives in India. And that attracted me to this area of research, and I'm still working on that. My basic work is on the medical missions in India, but recently I have started working on the Canadian Canadian Baptist contribution in the history of medical missions in India as well. So my paper is called Baptist Medical Missions in India, a goodly heritage, within quote, put into those hands by God himself. The church in India as a whole made a great contribution to the field of healthcare. Treatment of common people became one of the main concerns of most of the missions throughout the period under review. Now, my period under review is 19th and 20th centuries. They felt it to be more urgent as the large sections of the tribal and poor had absolutely no opportunity to receive the services of physicians of the Indian Medical Service, or the IMS. That was the official organ of the colonial government in India. As a result, they had recourse only to tribal and ancient ritualistic practices, incantations, and black magic. However, as in other mission fields, nearly all missionaries had, at some time or other, been in a position to use whatever measure of medical skill they possessed in the healing of disease, and many of them had been able to accomplish such much good by means of this modest service, even though they might not have enjoyed the advantages of special medical training. These attempts of a non-professional kind have long been made by missionaries to sickness. Some of the main names are like Gabriel Bufton in 1636 and Hamilton in 1713 had cured the Muslim rulers of Delhi of painful maladies and in return received royal favors. The Trankaba mission had sent an occasional doctor to India, and the Baptist missionary William Carey's, whose picture is over there, companion, Dr. John Thomas, was a known physician, and in a colloquial sense, he may be termed as the first medical missionary to India. But organized medical missions are a phenomenon of the 19th and 20th centuries, which coincided with the fast development of the Western medical science. But there was as yet no clear perception of the methods of working to be followed, nor of the particular tasks devolving upon medical labor as special branch of missionary organization. The Baptists in India started their medical works from the late 19th century. In the words of Dr. Robert Fletcher Moorshead, Secretary of the Medical Mission Auxiliary, or the MMA, the medical wing of the BMS and an icon of medical missionaries in India, within quote, no finer heroism is to be found anywhere than that exhibited by the lives of missionary doctors and nurses. And for the sake of the younger generation in particular, it deserves to be told, unquote. According to him, there were at least three reasons that inspired the Baptists to immerse themselves into medical activities in foreign lands. First, the healing ministry of the Christ's medical servants, like that of their Lord and Master, recognizes the worth of a full human personality and seeks to benefit the whole man, even as it widens and exalts the mission of Christianity. Christ came to reveal God as our Father, and it is unthinkable that with so majestic an aim, he should fail to be the healer of the suffering children of God's earthly family. In his hands, the healing of the sick was the goodness, within quote, the goodness that revealed the glory. Secondly, we live in an age which boasts of its science. The scientific method is almost worshipped. At any rate, not to follow it is to be taught out of debt. It is just there that medical missions can be turned to tremendous advantage in the work of the gospel. For be it remembered, the scientific spirit has to be met and dealt with amongst the people on the mission field as well as at home. The medical missionary, because he is a scientific man, can reinforce the whole witness of the gospel, and by meeting science upon its own ground, withstand the onrush of materialism. Dr. Mushhade's last reason goes like this. There is the unquestioned fact that in medical missions, we have a tremendous instrument for personal evangelism. The point to grasp it is that this means adequate reinforcements, and above all, such additions to the ranks of our doctors and nurses as shall mean intensifying the spiritual atmosphere of our hospitals. Every doctor and nurse must be a winner of souls. In 1922, a medical board was formed by the MMA, or the Medical Mission Auxiliary in India. The purpose of the board was to coordinate the work of the different hospitals and dispensaries and promote efficiency of each unit. This was, in fact, the result of the United Conference that took place in Calcutta the same year. One of the recommendations of the conference concerning the medical missions with a view of securing the fullest spiritual results from medical work was to attach a full-time staff to each mission health centers and hospitals for evangelistic purposes. He could be a medical professional too. Dr. Albert Moore of the Florence Toole Memorial Hospital, Palwal in the Punjab, once conclusively commented that the absolute aim, within quote, of their medical work was evangelism, to reveal Christ in a way capable of understanding and to interpret the message of the language that touches the heart, or to bind a strong bond of brotherhood in a world full of strife and discord. The Baptist missionaries worked. Reverend W.Y. Fullerton, in a history of the Baptist medical missions, wrote in the monograph called Midway to the Jubilee that the endeavors of the medical missionaries were always to hail and that they should continue to meet suffering and try to alleviate it. Fullerton felt, like most of his colleagues, that there was a holy duty not only to save them from disease, but also to promise, within quote, them, within quote, a throne in heaven. The Christian belief of the Baptists was so strong that, in fact, helped them to boast for whatever they were doing in terms of their overseas medical activities, notwithstanding the fact that those were definitely praiseworthy. They believe that the love of God, which was interpreted in such an unforgettable experience as that of physical healing, became a real fact to those who met it in the mission hospitals or dispensaries, and when they returned to their communities, a majority of them had passed on at least some of the messages they had learned, that God, within quote, cares for his children. The Baptist Health Service, as a result, was a practical share in the far-reaching kingdom of God, within quote, that worked not to relieve only the pain from a patient's body, but saved him from the onslaught of superstitions, ignorance, and sins. The share which women were called upon to take in the work of the medical missions in Indian subcontinent was massive and important. The Edinburgh Conference of 1910 pointed out that without the work that could be done by Christian women and done by them alone, the task of the medical missions would be incomplete. First, by women doctors alone could the very great amount of pitiful suffering prevailing amongst immense multitudes of the native women in India be effectually alleviated or cured in their hours of travails. John Lowe, in Medical Missions, Their Place and Power, published from London in 1913, presented a vivid description of the plight of suffering women in India. The overall Pada system in India and the institution of the harem amongst the Muslims made the situation more pathetic and decisive that women patients could only be reached effectively by women doctors, and fortunately, in most cases, religion played little obstacles. Secondly, by reaching sick women and winning their confidence, the women medical missionary, with their caring and loving compassion, was enabled to weaken their superstitious notion of disease and cure. In a world of more or less seclusion, the women in India could seldom get an opportunity to do away with the age-old beliefs and practices that worsen their conditions. The women medical missionaries could work as a powerful auxiliary in the illumination of those dark patches. Thirdly, it was rightly observed that bringing in of women medical missionaries from the West could hardly meet the need of thousands of sick and prejudiced women of the Orient, including India. Rather, by women mission doctors and their work as educationists, could the native Christian women be trained to become medical missionaries to their own countrywomen? Fourthly, it was once again correctly pointed out that the women mission doctors and their work could influence the men of this country to understand the true dignity of womanhood and show the respect they're supposed to have. To see Christian lady doctors coming to a country especially to care for its sick women, to witness sums of money being spent for the erection of hospitals in which to treat exclusively women who were ill, could work as, within quote, an absolute revolution to a majority of men in India, which led them to think differently of their women and gradually to conceive a higher status for them than that they had. Finally, the medical missionaries with a powerful access to the non-Christian homes could act as proselytizing agents as well. Thus, they could satiate the zeal of the evangelistic desire of many missions, including those of the Baptists. A graphic description quoted in Arthur H. Smith in Rex Christus, published from London once again in 1913, by the first Baptist woman doctor worked in the province of Odisha, Nina Ottman, showed how native families came closer to the Christ when the Baptist women medical missionaries explained Christianity to the ladies of the families. Massive medical mission activities were also undertaken by the Canadian Baptist Mission among the tribal and downtrodden communities in the modern Indian provinces of Odisha, Telangana, Andhra Pradesh, and the entire coastal regions up to the southern tip. The Canadian Baptist Mission was established in the year 1850 and had its work stretched from the river Krishna in the south to Odisha in the north, that also covered a long tract of the eastern coastal line. Headquartered at Toronto, the missions worked for 76 years in the whole of the Madras Presidency. Samuel Stearns Day was the first Canadian Baptist worked in India since 1835 as a member of the American Baptist Missionary Union, which eventually created a Canadian auxiliary in 1866. In 1869, the Canadian auxiliary was reorganized as the regular Baptist Foreign Missionary Society of Canada. And in 1889, the name was changed to the Board of Foreign Missions of the Baptist Convention of Ontario and Quebec. In 1912, this convention was merged with the Bingley-Putnam Mission of the Maritime Baptists to form the Canadian Baptist Foreign Missionary Society. Although the Canadian Baptist missionaries saw medicine in the initial years as a so-called tool, it was gradually accepted as an integral part of their missionary enterprise. It was because of their medical mission that the poorer sections of that entire stretch of land could access to proper treatment, with the establishment of numerous primary healthcare centers, dispensaries, and hospitals. Although medical undertakings were oriented towards the notion of preach and heal, the introduction of Western medication created confidence not only among the beneficiaries, but also created a self-assurance among the benefactors to invigorate their medical work as well. The strength of time, let me come to the conclusion. The most remarkable contribution of CBM was the establishment of hospitals in Ganjam. And the primary reason for this was to reach the indigenous hill people and ensure proper medication to them. Missionaries Reverend Orchard and McLaurin reported that, within quote, the hills would not come to the doctor, so the doctor will go to the hills. The first missionary to be called for medical treatment, as we have seen, was Reverend J.A. Glendinning, who started his work where the British colonial government never cared to pay any attention to the medical needs of the population. Although there was a government hospital near Parlakimedi, the locals did not visit there out of fear. The government, on the other hand, had no interest to treat them. The poor tribes relied on their unscientific traditional remedies, which ultimately took a heavy toll on their lives. They suffered and died without medical treatment. Glendinning provided these people with medicines and dressings for immediate effect, which drew the latter's attention, and they started responding to its usage. It was a different sort of practical application of Western medical knowledge, which surrounded the history of medicine, systematic knowledge of body and its clinical interactions, as well as the comparatively better outlook on human existence. And the contribution of the Canadian Baptist medical missions cannot be ignored or overlooked. It is an example of devotion, dedication, and conviction, which could set as a wonderful precedence for anyone involved in public health services. Once Secretary of the Baptist Medical Mission Auxiliary said, "No finer heroism is to be found anywhere than that exhibited by the lives of missionary doctors and nurses, and for the sake of the younger generation in particular, it deserves to be told." Even in the independent India, when the situations changed and probably into a more disadvantageous one for the missionaries to work, they frequently looked into the Bible to draw support and inspiration. In a Baptist booklet called A Goodly Heritage, they put that in this way, within quote, "We Baptists of the mid-20th century have in this healing ministry overseas a goodly heritage, not fashioned by our own hands, but wrought and put into those hands by God Himself and by His agents throughout the years. Thank you.